Hi, everyone, and welcome to another episode of Wellness Day, a podcast that's coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, as always, here from the lovely JWC studio. And today I've got a very, very special guest. I've got Dr. Nilesh Kamat, who is a shoulder and sports surgeon, and we're going to be talking about all things from shoulders to knees to hips. Thank you so much for being here, first of all, Doc.
Thank you so much for having me over. The pleasure is all mine.
Absolutely, and I know that we said that you're a shoulder surgeon to start off with. So we are going to be shouldering a lot of responsibility today as we talk about everything from shoulders. And I did say we'll be talking about knees and hips as well. But I would like to start off because everyone talks about knee surgery and hip surgery, but shoulder surgery is really not talked about as much. People talk about shoulder injuries, but not shoulder surgeries. So I just thought we'd start right there. And how did you get into this?
It's interesting you mentioned this because probably shoulder is considered as the dark side of orthopedics. So
dark
just
side.
to give you a fun fact, probably in my residency,
Yeah.
during my training period, I would have seen the least number of shoulder sports related injuries as what I would be doing in my day-to-day practice.
Okay.
But that's where shoulder surgery has undergone a massive evolution in the last 2 decades.
Why is that? Because you always hear about people getting shoulder injuries, but not as much for surgeries in terms of injuries wise. Yeah.
So I reckon the answer probably would be multifold because number one is better understanding with better imaging. You have 3 Tesla MRIs, you have dynamic scans, you have good ultrasounds, you have better knowledge, better equipment, keyhole surgeries. So the understanding of pathologies has gone up significantly,
Yeah.
right? Second thing, if you look at the average population now, especially in India,
Yeah.
no one likes to live with disability.
Absolutely.
So let me give you an example. If I were to look at my parents or my grandparents, right? If they would have a shoulder problem,
Yeah.
and if you were to ask them that to not do that particular activity which brings on pain, they would probably refrain from doing that.
Okay.
Now, how many of the young active individuals in today's day and age would refrain from doing something because there is pain?
Right.
They would go around and try to fix that
Absolutely.
cause of pain and then get back to normalcy.
Which is what we want.
That's exactly
people to do.
what's happening.
Absolutely.
That's what's happening now. So yes, the number of shoulder surgeries has gone up immensely. Just to kind of brief this further, what I do is shoulder arthroscopy. So
Right.
again, when we were residents, all shoulder surgeries were open surgeries. And when
Yeah.
I'm talking about open surgeries, it means you're taking a big incision, a big cut.
Big cut.
There's prolonged rehabilitation, longer stay in the hospitals. And if you were to look at that in today's day and age, most of the work that we do in Jehangir is pretty much keyhole surgeries.
Which is what exactly?
That's exactly what is arthroscopy. So if I have a muscle tear,
Right.
if I have a young patient who's dislocating his shoulder, I don't need to cut him open. I'm
Yeah.
going to use a 4mm camera. I'm going to get in with stab incisions, so smaller, less than 1 centimeter incisions.
Wow.
Fix up the pathology,
Yeah.
get him into a sling, get him home the next day itself. So the stay is not for more than 1 day. At the most, probably 2 days if you're looking at
And
the shoulder.
fairly minimally invasive in that
Minimally
sense.
invasive.
Yeah.
Minimally invasive. So I think
Are people awake when they're doing that? Or can they be awake? I would not be wanting to be awake, but can you be awake is the
we've
question.
been there, we've done that.
Okay.
We've operated in patients under what is known as regional anesthesia.
Yeah, exactly.
But when you're doing shoulder arthroscopy, the positioning is slightly awkward.
Got it.
Because you do it in a sideways position, what is known as a lateral decubitus position. And because you're doing this under normal saline, so there is a lot of fluid around.
Got
so
it, yeah.
it's uncomfortable for patients. But answering your question,
But it is
can you do it arthroscopic? Yes.
Okay.
You can do it as a wide awake surgery.
right.
But most of the time we do it under general
Okay.
anesthetic. Right?
But what are the most common type of injuries, shoulder particularly, since we're talking about that or focusing on that a little bit more? What are the kind of injuries that you see that come to you now?
Well, it's mixed bag, right?
Yeah.
Because if you're looking at a younger guy, let's say someone who's 20, 25, the likelihood of him dislocating the shoulder is quite high. And there is a reason for it. Because if you look at the shoulder effectively by configuration is a ball and a socket,
Yep.
right? Even the hip joint is a ball and socket. How many times have you heard that the hip is dislocating? Barely any times,
That's
right?
true, yeah.
That's because the function of shoulder is mobility over stability. Hip joint is stability over mobility. And it's amazing
yeah.
how nature takes care of this.
Yeah.
Because shoulder, you want to move it in all directions.
Absolutely, yeah.
Whereas hip, you want to be stable on your hips. So whenever you're looking at mobility, it comes at a cost of stability. And
Okay.
that's the reason why shoulder joints are probably the most commonly dislocated
I
joints.
see. There's always a trade-off between stability
Trade-off.
and mobility. Okay.
That's the younger class, right?
Yeah.
You look at elderly patients, right, where the muscles are not in great quality, but still, as the level of independence is going up, you would have folks traveling all around the globe, all over.
Yeah, yeah, yeah.
You're getting a bag of the conveyor belt. You're going to jerk your shoulder. You'll have
Oh,
a
right.
rotator cuff
Right,
tear.
right.
Right. That's the likelihood of in the elderly patients. In the middle age, well, it could be anything from a frozen shoulder to overuse related injuries to some calcium deposition in the tendon called as calcific tendonitis.
Got it. Yeah, yeah.
So shoulder is unique in that point that different age groups would be having a different set of problems.
Absolutely,
Although
yeah.
there could be some overlap, but even when we teach our colleagues, we tell them that look at the age and then dictate your history and your clinical examination.
Right.
Right. So that's the thing. So
Things like hips and knees, people talk about as talk about different age categories. Older people now, there's a common thing about getting a knee replacement or a hip replacement. Can you get a shoulder replacement?
oh, actually, so there are two forms of shoulder replacement that you're looking at.
Okay.
Right, or rather three, if I were to further categorize them.
Right.
One is you look at the arthritis of a particular joint. Arthritis, if I were to break this down, it's purely wear and tear of the cartilage. And that's age related pretty much because of overuse, genetics, and so on and so forth.
Right.
In the Indian population, knee joints are the most commonly replaced joints, followed by the hip joints, and then followed by the shoulder joints.
Okay.
So shoulder joints are common, right? That's
Right.
one
Yeah,
thing.
yeah.
The second part is if you have a rotator cuff tear. Rotator cuff is one of the most important group of muscles in the shoulder.
Yeah.
And if that's not catered to and not taken care of, these patients have a sequelae of that, and they have a different form of arthritis. That's another indication for an arthritis.
Okay, yeah.
And lastly, if you have a patient who is another indication for replacement. And lastly, you have a patient who's got a crushed shoulder where you just can't put the jigsaw across, right? When you're fixing a fracture, you need to put the jigsaw across. But
Yeah.
shoulder ball does not have great blood supply. And if you feel that the blood supply is not going to hold the healing,
Yeah.
in those scenarios, you do a replacement.
Right.
So the indications are varied, right? But you need to use the right indication for the right patient. That's what's important.
So actually, the takeaway from the question I was asking is actually there's no one common injury that comes through for shoulder or the most popular one. There's like a wide spectrum of thing, which comes back to the very insightful thing that you said is that the shoulder has the function of mobility versus stability versus hip, which is primarily just for stability. So it's interesting to see how the shoulder has such a vast importance or wide-ranging, literally mobility
Absolutely,
that
absolutely.
one needs to be mindful of. Absolutely. So coming back to the rotator cuff point, because the word rotator cuff, sent a signal in my head because it's something I've been working on lately in the last couple of years in the gym, particularly. Just the importance of rotator cuff exercises. Because earlier when I just started my gym journey, it used to be a lot of bench pressing and so forth. And I remember the early days, I'd leave the gym feeling, oh, my back of my shoulder is feeling, or rather the inside of the shoulder is feeling pretty tight or tender.
Right.
And through my experience and then talking to a lot of people, the focus on rotator cuffs has become a big thing for me, which was reminding me of the question I wanted to ask you, is that this is actually unique podcast that I'm doing today, because everyone that I've spoken to for preventive side, I've always asked them, what can you do to prevent this? What can you do to prevent that? An injury can be something that can happen at any moment. So there's nothing per se that you can do to prevent that.
Very true.
But the question I was going to ask you is, what are the best things that we can do to limit that to the best of our extent?
So that's an interesting question, right? Because I think one of the most important take homes, if we were to give one out of this conversation, is avoid being a weekend warrior. What do you mean by weekend warrior?
Okay.
So you see a lot of young guys and middle-aged guys who have a hectic life.
And girls, I'm sure.
Of course, absolutely. And everyone would want to work right from Monday through to Friday.
Right.
And Saturday, Sunday, they would want to go on treks and they would want to play sports like tennis and pickleball and squash and literally overuse injuries. So you don't want to do that. You want to do age-appropriate things. You would want to do things for which your body is conditioned. So it's important that if you want to do all this over the weekend, then you need to condition your body. The simplest example is first time ever you hit the gym, you're not going to go and take a 25 kg dumbbell.
Yeah,
We're
absolutely.
going to start off with a 2.55 kg dumbbell and then
Build
gradually
up.
escalate, right? Likewise, I think for shoulder, it's prudent that you first get mobility, then get strength, and then increase the endurance. The another myth which people have is that if I'm going to pump a lot of iron, I'm going to be injury free. No, in fact, that's a wrong thing,
Absolutely.
right? Understand, a tight muscle is not a strong muscle.
Yeah,
And
absolutely.
a strong muscle ideally should not be tight. And that's where the importance of stretches and warm up comes into picture in context to your question.
Yeah.
So if you want to avoid injuries, let's say, assume that you're talking about someone who likes going to the gym, right? He wakes up in the morning at 6:30. He knows he needs to leave for office at 9 o'clock. He's got those 45 minutes that he wants to squeeze in everything. He wants to squeeze in his showers. He wants to squeeze in workout, getting ready, being at work in time. It's
But
prudent.
describing me,
Absolutely.
except I wake
There
up
you
at
go.
6, not
So
6:30.
fair enough. But what is important here is that it's okay to work out less,
Yeah.
but it's important to stretch out. It's important to warm up. And that's what's going to keep you injury free.
I 100% agree with you, which is exactly why the story of this rotator cuff thing came back to me. Like how I started off, it was exactly this. So let's pump this iron, let's pump that iron.
Absolutely.
And I started feeling it in my shoulders. And luckily, touch wood, I didn't get any injuries.
Right.
But, as I progressed in my experience and understanding of my body, I've been spending a lot of time exactly on this, working on the stretches and the dynamic stretches on rotator cuff or whatever it is
Yes.
to keep everything nimble and greased up so that when you do the exercise, it's primed for that.
True, true. If I were to add one more point, right? So
Please.
you understand one thing, that pain is a protective phenomenon.
Yeah.
Anything that brings on pain is to be avoided. Your body is simply
Yeah.
trying to tell you that something's off. It's like, let's say you stick out your hand and put it in fire, it's going to hurt you. That's why you're going to take it off. If you're going to keep it there, it's going to be charred. Apply the same principle when you're working out, when you're playing sports. If there is pain, you need to take a step back.
Yeah.
Because if you don't do that, it's going to lead to more catastrophic results.
Absolutely.
That's not something which is...
So let me ask you this then, Doc. You see so many injuries, and we've just been talking about exercise. So I'm sure you have a huge knowledge base in your head about what works, what doesn't work. So what do you do for your own exercise knowing this?
Interesting you mentioned this. Okay, so thrice a week,
Yeah.
I just do stretches.
Oh, really? Okay.
Thrice a week, I just do stretches.
Uh-huh.
I try to do cardios once or twice because I
Right.
hate cardios, but minimum twice a week I do workout, right? I do gym training. One day has to be mandatory rest day,
Absolutely.
right? So
Yep.
it's again because I like it. That doesn't mean that I'm going to do it. No, right? It's okay to allow the body to recover, to recuperate, to prevent or to recover, right?
Yep.
If you don't do that, it's not going to work right. And one more thing that you could get your viewers to encourage to do
Right.
is to incorporate a sport, because that's the best way of working out without really feeling bored.
Yeah. And everyone is playing pickleball now.
Absolutely. So racket sports, though, that actually is if you're going ahead with pickleball, tennis, say squash, right? Racket sports is important that you need to have great core strength.
Yeah.
Because
Yeah.
understand, what you are generating force is not from your shoulder. If your core is not good,
Right.
and if you're going to generate all the force from your shoulder, the chances of you injuring the shoulder is manifold.
Yeah, absolutely.
And that's something very important. That's why core exercises
Absolutely.
is
And that's the reason I brought up actually pickleball and these other racket sport related, the ones that we talked about, because somehow there's always a shoulder related injury that comes out of them. So I thought that we would just quickly touch base on that. And what you said earlier also, people should be mindful that they need to build up to that, because now pickleball has become so popular. And I love the fact that it's accessible to everyone, from someone who's 20 to someone who's 60 or 70, 80 is playing that. So
I also think that the infrastructure in India has undergone a radical change.
Right.
Let's look at Pune. Probably the Pune in 1990s and the Pune that is there in 2020s right
Yep,
now,
yep.
right? You can't relate to it, right? So I think that's something important. Availability of all the resources, but utilizing them to the correct potential.
Absolutely.
That's what is important.
Okay. Next question, Doc. What are the biggest myths in shoulder injuries and surgeries that come to you that you would like to address?
In sports med, one of the biggest myths
Yep.
is everything needs surgery.
Ah,
That's probably the biggest myth because that's not how it works. Right?
I love that you're saying that as a surgeon.
But that's true.
That really is a try. That's the sign of a great surgeon, actually.
I guess because many people come in with a mindset thinking that because they're going to need surgery,
Right.
I don't want to see a doctor.
Yeah.
Right. Let's take a simple example. You must have heard of a structure called iliotibial band. It's called ITB.
Well,
Very
yeah,
common among
yeah,
runners.
yeah.
It's an extension of your glutes, right? And it's surprising to see so many people in the young active population having ITB tightness. And they land up with knee pain and hip pain. But then this pain is not a result of any kind of structural damage in the knee,
Yeah.
right? Or in the hip for that matter.
Right.
It's purely, it's like saying that you're getting a door, the hinges are not oiled well. That's the reason why the door is tight and you can't function well, right? Likewise, if you work on the ITB tightness, half your symptoms can settle down. And of course, this is subject to certain particular conditions
Right.
that I'm talking about. So
Which is where, again, stretching comes into
again,
picture.
stretching comes
Yeah.
into picture, right?
Yeah.
So that's something which is important. Second thing is a common myth amongst patients. I don't want to take painkillers, right? You must have heard this like a zillion times.
The way you're saying that patients say that they don't want to take
Yes,
painkillers.
this is
right.
not uncommon that you write a prescription for them, and the first thing they would be like, I don't want to take painkillers.
Okay.
But what you need to understand is
Right.
this comes under the genre called non-steroidal anti-inflammatory drugs.
Okay.
So sometimes as a treating clinician, I don't feel that it's for the pain. I understand your endurance is great. You can take pain. You can take many-fold pain. But
Right.
that's not the point. When something is being prescribed, it's probably as an anti-inflammatory. So that allows the inflammation to come down. That allows the pain to come down, which is an added benefit. You should not do unsupervised medication because that is
Absolutely.
not good.
But I guess there's this fear that people think that they'll get addicted to it or they'll get dependent on it and stuff like that. So I guess that is the aspect that one needs to break down.
Absolutely right. And I guess lastly, the other thing which people need to understand is that when you talk about shoulder pathologies, it's not that if you do it only for that period, you're sorted for life. Right? If a particular condition, like let's say rotator cuff overuse, has been taken care of during that tenure by exercises, it's important to incorporate them in your routine when you continue leading an active lifestyle.
Right.
Because if you don't do that, there's a chance that it's going to recur again.
Okay.
And then thinking that it's been there with me for a long time. No, you don't need to live with it for a long time.
Okay. Well, Doc, my final question, looking to the future.
Yes.
We talked about how shoulder surgery has come such a long way in the last 10 years. Now with things like robotics that everyone is talking about, whether it's, no, I don't say fad, but whether it's a buzzword or just marketing today or there's actually value to it. There's definitely value to it in aspects.
Right.
What is your take on it, particularly for the shoulder and where the future is for it?
I'm glad you touched this because, and not for any other reason, because this is the next big thing.
Yeah,
around-
and the reason I'm asking is because anything that will enhance anyone's ability to be well is something that we'll always be happy about.
So you must have heard of robotics being used for hip replacements, for knee replacements.
Yeah.
What about shoulder? Now think about it, that shoulder is a multi-axial joint. Simply, it's going to move in different planes. And your ball is going to move on the socket.
Yeah.
Now, it's interesting to know that every person of us who's sitting out here would have their socket placed in a different inclination. Right?
Okay.
That means
Yeah.
it's not the same thing. It's going to be different for me. It's going to be different for you.
Right.
And that's where robotics is going to be the next big thing for shoulder replacements. So
Okay.
they are coming in the Western world. They're coming up with launches for shoulder replacement, robotics in shoulder replacement. You ask me the same question, say another 5 years down the
Okay.
line, I won't be surprised that every second shoulder surgeon is getting some form of either navigation or technology assist or robotics, which is a part and parcel of their routine.
Right.
Let's say 50 years back, if you were talking to someone that I'm going to put in a camera and I'm going to sort out your shoulder, you would be laughed out. They would be saying that this guy
Yeah, it's exactly.
is really off his head, right? Now think about the same thing. We're sitting here in 2025. Going forwards, I'm not even talking 50 years. I'm talking, say, 4 to 5 years,
Absolutely.
right? It's something which is an absolute reality.
And this is something that you think that will really enhance you and your ability to heal people
Absolutely.
versus being a threat,
Absolutely. I think so.
which is a lovely mindset to have and the correct mindset to have.
I feel that when it comes to medical science, it needs to be a blend between technology and knowledge.
Absolutely.
I can't be relying on technology all the way.
Right.
Right. But at the same time, I can't just be gloating and saying that I know everything. No.
Absolutely, yeah.
Right. I need to bow down in front of technology because that's the need of the hour.
Yeah.
And if I can get a fusion of both the things, I think that's brilliant.
Yeah.
That's what you're looking at.
Well, it's lovely that we've got someone like you leading the charge for us, Doc.
Thanks.
So thank you so much for being here. And it's been absolutely incredible hearing about the various aspects of the shoulder, which is, as you said, the dark side of orthopedics. But, as that grows, we're extremely happy that you'll be leading that charge for us. So thank you so much for being here.
Once again, thank you so much for having me over. Pleasure is all mine.
Absolutely. Thank you. Thank you all, and see you again for next week's episode. Thank you.